To this virtual conference call. My name is Greg Jones with Centennial Health. I'm the Director of Community Outreach. Thank you so much for being with us. I assume you probably received our text message that we sent out yesterday. Today, we're going to just be talking about the COVID-19 vaccination. Many of our patients and community residents have lots of questions. And so Dr. Charles Lund has graciously offered to really come through, discuss the process of the vaccination. So what we're going to do initially first is do a couple of housekeeping tips. Number one, there will be an opportunity to ask questions. If you're familiar with Zoom, there is a chat box. If you have specific questions, you can put those questions in the chat box, and I will be reading those questions for Dr. Lund. At the very end, we may have an opportunity to open up the virtual line to let those of you that have individual questions that weren't answered during the question and answer period an opportunity to get your questions answered. We're going to have a community conversation with a couple of our community folks that live in the community, and I'll introduce them as well in just a moment. What I thought I would do initially is start out with a short, about a 6-minute video that has been published recently in the last few days by the Oklahoma State Department of Health, talking about the vaccine rollout and all of the different phases. And so what I'm going to do is I'm going to start out by playing that 6-minute video so that we can all watch that. And then after that video, then start the conversation with Dr. Lund. Again, those of you that have just joined us, welcome to this conversation with Centennial Health, Dr. Charles Lund. We're glad to see you and glad that you will be able to be part of this as well. As a common courtesy, if you will advise, that way we don't pick up a lot of background noise. Okay, we're going to get started. I'm going to share the screen and then I'm going to play the video.
Hello, I'm Keith Reed, Deputy Commissioner for the Oklahoma State Department of Health, and I'm here to talk to you about the rollout of our COVID-19 vaccination program. This is our opportunity to turn the tide on this pandemic. So I want to talk a little bit about phases and priority groups. These are two terms that's been thrown out a lot when talking about our plan. We have 4 phases, starting with phase 1. Now, this is a time period when vaccine supply is going to be very limited in the state. And during this particular phase, we will be very focused on priority groups, getting the limited vaccine to those populations that are very important for our response to the pandemic so that we can mitigate some of the effects. So in this particular phase, just getting rolled out on the vaccination program, we're focused on frontline healthcare workers that are either providing direct care or direct support to COVID-19 patients. So this is really the hospital inpatient setting. Also in this group, we're focused on long-term care, staff, and residents. And this is going to be done through a federal partnership program with our pharmacy partners at CVS and Walgreens. And they are in the midst right now scheduling these clinics with long-term care centers all across the state. And that will run concurrent to our efforts on getting some of the other populations in phase 1. We're including public health frontline workers that are doing pandemic mitigation efforts, and we will also be taking care of EMS and paramedics at that point of the response as well. Phase 2 is where the supply increases and starts to help meet the demand. At this point, we will start adjusting our approach and expanding access points. Probably you will see large-scale vaccination clinics around the state so we can process larger populations at any given time as opposed to very narrow clinics based off of limited vaccine. So in phase 2, we expect significantly more vaccine, and we will expand our priority groups to groups like the 65 and older population. So pretty large numbers will start to emerge and be eligible for vaccine during phase 2. At this phase, we're going to pull in our first responders, And we will also pull in our additional healthcare workers that did not meet the criteria for the phase 1, priority 1 response. So these may be those that are working in outpatient settings or other settings to where they might come in contact with somebody with COVID, but aren't necessarily treating them in an inpatient setting. Also in this particular phase, we're including support public health roles. So this is public health support functions that are trying to keep the frontline mitigation efforts working. And with that group, we also include some congregate housing, which are areas where individuals do not have the ability to take some of the precautions that others might be able to, like social distancing, to prevent the spread of disease. We have seen throughout the pandemic response, those kind of settings, individuals are particularly susceptible to large-scale outbreaks, and we want to mitigate those outbreaks. Now, also in phase 2, we are going to move our K through 12 teachers into this particular section. And the goal here is to try to help get our schools back up and functioning. We want kids in the classroom. We recognize that's the best case scenario for them, and that's important. So getting our teachers protected, that's a big step to getting them back into face-to-face instruction. So those are our groups that we're looking at for phase 2 at this time. As we move into phase 3, again, we expect vaccine to be very readily available at that point, many access points around the state. This is where we will look at expanding the teacher population, so colleges, universities, vocational schools, anybody that we didn't catch in that K through 12 educational setting, we want to try to catch in this particular phase. And also we want to make sure and get our critical infrastructure. These are individuals that are in career fields that are very critical to the functioning of society. So those are the groups in phase 3. Again, phase 3, vaccines should be readily available, good access points around the state. Phase 4 is really open to anybody. This is where we definitely have good supply, good access points. Many private providers should have vaccine. So lots of access points. At this point, we can catch anybody remaining that wants to get a vaccination. We can get them vaccinated at that point. So now that we've talked about the great potential of a COVID-19 vaccination program, it's important to remind everybody that this will take months to roll out, and we cannot afford to let down our guard at this point. So we want to remind everybody, wear your mask, watch your distance, and wash your hands. We got to remain vigilant in order to manage the impact of this pandemic moving forward. The vaccination program is a great offering, a potential solution for us, but it's going to take time before it has the impact we really need it to take. So everybody's still going to have to take personal responsibility. Again, wear a mask, wash your hands, watch your distance so that we can prevent the spread of COVID-19.
All right, again, thank you. Those of you that just joined us, we just showed a video from the Oklahoma State Department of Health. Again, my name is Greg Jones with Centennial Health, Director of Community Outreach. Thank you for joining us for this conversation as it relates to the COVID-19 vaccination. Dr. Charles Lund, who is the Medical Director, been practicing over 30 years for Centennial Health, is going to really field some questions from a couple of folks in the community. Rita Freeney, who is President, of Sisters in Motions and Brothers 2, a longtime community advocate here in the Northeast quadrant of the city. And then William Jones, who spent a number of years in the mental health industry as well. So they're kind of our guest panelists, if you will. And I'm going to turn the conversation over to Dr. Lund and Rita and Will. Again, if you're on the call and you have questions, there is a chat box down at the bottom if you're familiar with Zoom. If you want to put a question in there, feel free to put a question in the chat box. I will be reading those questions or going through those questions as they come up and make sure that they get an opportunity to get answered during the call. Okay, Dr. Lund?
Hello, good afternoon. Thank you so much for joining me. I fielded an awful lot of questions about the vaccination, so I thought I'm having this conversation in exam room, so I thought I'd have it maybe not in exam room, maybe on this little box we've got here. Um, the first thing to tell people is there's no contraindications for somebody getting a vaccine. So when somebody says, "Hey doc, should I get the vaccine?" the answer I'm always going to say is yes. When I say yes, I entered the phase 2 just last week. We went to phase 2, and I went and got my vaccine last week, and I will tell you how it went great. Um, I will tell you personally, I pre-medicated myself with a Benadryl. I took a Tylenol. I went in, got my vaccination. Everything went great. I waited the 15 minutes. I left, and my arm was a little sore the next day. I will tell you anecdotally, one of my partners got it, and he was sort of fussy, like my 3-year-old. When I took her to get her vaccination, the next day he was a little fussy. I could have picked him up and patted him down, but otherwise, the vaccine is safe. So far, we've got 3 million people worldwide who've taken the vaccine with about 6 serious allergic reactions. That's when people start using terms 1 in a million, 6 in a million is pretty good. The serious reactions, nobody, no deaths. I think there were 2 hospitalizations. Anyway, with that, I'm done talking. I want to answer questions. So, Mr. Jones, Rita, do you have questions for me? I'm assuming you will have some of the same questions that everybody else on the call has.
Well, Dr. Luntz, I also like to say, if I may, I appreciate being here in this opportunity. And the biggest battle each and every one of us going to have to fight is the mental battle. Because of what we think in our past and what we felt from one person saying A, another person saying B, there's all kind of obstacles that we create for ourselves that may hesitate us from taking this shot. But like Dr. Luntz has said already, it is safe and it's needed. If we are to put a curve on this or stop this pandemic, we have to take these shots and create immunity to make it happen. And the biggest battle is going to be in our minds. Not only our minds, but the people around us. So Dr. Luntz, with that said, what are we doing as a medical group to fight that battle of mental ideals that are going through our minds?
Well, when we say I've been really impressed on, and when I say we, I'm talking about communities of Black and Brown people. The CDC and all the other organizations, the first time I've ever seen in my medical career, they are talking to minority groups and being very, very clear to dispel the issues of whether we're being experimented on. They have been so clear on how they run the clinical trials. I'll just give you an example. To do a clinical trial, you have to have 30,000 people. 15,000 get a placebo, 15,000 get the vaccination. With that said, then they wait till 100 people get sick. Now, in measles, years ago, it took 6 years for the 30,000 people, for 100,000 people, for 100 people to catch the virus. This disease, we have 2 to 3 Okies getting positive every day, so it only took a month. The clinical trials have been amazing. The fact that I can see data and I can quote to you that 3 million people worldwide took it, and we have data on how many people got sick, that is amazing. And I'll just quit talking. You say, ask me more questions. I'll try to be shorter.
Go ahead.
I was going to say, I got a question in the chat for you, Doctor. You mentioned, Dr. Lund, that you took a Benadryl before your injection. Why did you take some Benadryl?
I was afraid. I was afraid that I would have an allergic reaction. Now, as a doctor, I already know that that's, a lot of times people have mild allergic reactions to something and they're a little itchy or they don't feel good. It's the same thing I did for my child when she got immunizations. I pre-medicated her. We often, when we have children come in, we pre-medicate them. So I did take a Benadryl for Tylenol because I just didn't want to deal with the maybe having a mild allergic reaction. And that's perfectly safe in the vast majority of people. Like there's hardly anybody that can't take a Benadryl. And there's almost nobody who can't take a Tylenol. So that's my answer to that.
I was gonna say, doctor, also, why do you even take the pneumonia shot? You take Motrin and medication like that to make yourself feel better, because if you do take that shot mentally and you start feeling sick, the first thing you may think is negative things about, I'm getting ready to get COVID or something's wrong. But those are things that normally happen when you take shots.
Right.
And so we have to realize that some things normally happen and be prepared for them, as in taking the Benadryl and taking other medication to help the shot be easier, regardless of what it might be. Would you say, Doc?
I would agree. I am a big proponent of doing stuff that won't hurt you but may help you, and that just makes my life easier. When I tell people to do those things, just so that like, what's the side effect of a Benadryl is you'll be slightly drowsy and you'll sleep better. Those are not bad side effects.
Tylenol?
Tylenol almost has no side effects. A vast majority of people in this country can take up to 2,000 grams of Tylenol. And one of the things that most people don't understand, Tylenol runs through your liver, not your kidneys. So you have to take a whole bunch of Tylenol to really hurt yourself. So taking 325 milligrams is almost nothing. But we give 100 milligrams to babies.
So how often before the test will you take that shot, those Tylenol pills? Before you actually took the shot?
I actually took it about 45 minutes before I took it.
Were there,
Well in my system. Yes, ma'am.
Dr. Lund, are there any specific references or resources that people can go to? Because that's the major is fear. And when we have more education or more knowledge of what we're doing, it does dispel a lot of the fear. So are there resources, researches, videos that someone can go and listen to dispel?
And that's a great question. The place I go to is the CDC and NIH, the National Health Institute. They have great videos, and they also have really good information. I do have a problem with that. The information, this is science. This disease is 1 year old today.
Right.
So the science changes. People think science is static. If it was static, I'd be still having a jar of leeches giving people. We know that's not good. So go to the CDC website, go to the NIH, and Greg is posting things on our website. So I'm actually trying to help Greg, and Greg's helping me distill this information in a nice little chunk that people can understand and take a bite of. So you can go to the Centennial Health website or our Facebook page, and we will post information as up to date as possible.
I'm glad you said that, because Greg did share some really phenomenal information with us. Just
really good.
So I really would suggest and piggyback on people going to your website to view that, because it really helped me personally, and it helped me to make a better decision as well. So thank you for
good. Yeah.
Got a question, Dr. Lund, in the chat. If I have diabetes and hypertension, will that cause an issue getting the vaccination?
No. Can I be more clear? No. Nope. You need to get it. Everybody has these underlying. And I'll tell you, I got hypertension. I'm a 59-year-old Black guy with hypertension. I'm at high risk because I see patients every day. So there is no, it's not going to make your diabetes or hypertension worse. Only if you get corona will make it worse. Other questions?
Allergies also is a concern.
Allergies? Allergies to the vaccine or allergies in general?
Allergies in general.
Yeah, so allergies is a real problem, because I have lots of people come to my office and they say, I've got sinuses, my nose is running. And it makes me nervous. And because every week we have somebody that says they have allergies, and we test them and they've got the virus. So you can't really tell. Now in the winter, you talk about seasonal rhinitis, which is, spring and fall. It's not spring or fall, it's winter. So when I see somebody's got a runny nose and they're sniffing, it's, oh, it's my allergies. I'm going, no, I'm pretty sure that's corona. And we're going to check them.
Okay.
Dr.
What-
Lund,
Go ahead.
will Centennial have the vaccine, and if so, when?
So the answer is we will get the vaccine. The other answer is we don't know. We applied and we haven't got an answer. This rollout has been very, very, and that's one of the reasons we're having this call, because I don't know from week to week. Like I got my vaccine last Tuesday. Last Monday, I didn't know if I qualified for the vaccine. That's how fast this rolls.
Thank you.
For those that, Dr. Lund, another question came in. A person is a government worker and obviously works in an office setting and have seen lots of folks in their office actually contract the virus. This person is 62 years old, saying that what phase would she fall into in terms of opportunity to get the vaccination?
Phase, that would actually be phase 3 to 4. So and the phases will overlap. It would be whether you'd be phase 3 if you have an underlying condition. 62 apparently is not of an underlying condition. However, like my hypertension is an underlying condition. So it'll be basically as soon as somebody offers it to you, you can take it. And I think the phases are going to go outside of people who are very, very healthy, like my 22-year-old son. He's definitely going to be in phase 4.
And then also Dr. Lund saying that, is this vaccination, is it free or is it covered by insurance?
Free. The U.S. government has agreed to give this vaccine free, so it will not cost anything, which is a really good question. So the only way we're going to get a handle on this is to vaccinate everybody. And one of the biggest obstacles we have in America is if you charge for it. So it is free, or actually taxpayers, which is us.
What are the arrangements for the follow-up shot?
Oh, so right now you have 2 different vaccines, the Moderna and the Pfizer. I received the Pfizer. I would take either one. There is no difference. But right now you get the first vaccination, and then 21 days later you get the second vaccination. There is some current debate on whether you can get the second vaccine earlier than that. They're doing, and when you're getting millions of people vaccinated, you can come up with new information. The 2 of these vaccines, they are 95% efficacious with the 2 doses. However, they with 1 dose, it's about 80% efficacious. To give you an example, the mumps and measles vaccine are only 80% effective. So this is a remarkably effective vaccine. But the other side effect of this is you can still catch the disease, even having the vaccine. You just won't get as sick, meaning no hospitalization. The other drawback is that you're contagious if you do catch it. So those masks we've been wearing, we're going to have to keep wearing those.
Dr. Lund, another question in the comment, a person just recently had surgery and they're taking Percocet right now. Do you think it's okay for them to get vaccinated?
Sure.
Yeah, I will go back to there are no contraindications. Just basically, throw any condition at me and I'll say you can have the vaccine. You can say, I sail a boat, you can still get vaccinated. Everybody is a candidate.
I'm pregnant.
Oh, you still are a candidate, but that is a really good question, because they did not do clinical trials on pregnant or lactating women. And I will see if I can put in a link. I heard a really good conversation from a physician who is a nursing mother on why she decided to take the vaccine. That is such a good question. I'm glad you brought that up. They didn't do clinical trials on pregnant or nursing women. So that's going to be a personal choice on whether what you do. And I'll talk to Greg, and I'll try to put the link of that conversation that doctor had. She felt that, in the end of it, she felt that she needed to be alive for her child, so she just decided to take the vaccination. We will know with approximately 500,000 people getting vaccinated every day. Within 3 or 4 months, we'll know if there's any problem with the vaccine in pregnant or lactating people, because 70% of the healthcare workforce are women. And so there's a lot of women who are going to be pregnant and lactating, and we will have that information by March. But great question.
Thank you.
And now, Dr. Lund, another question that came in the chat was, how will we know when it's our time to get the vaccine? This individual is 74. Will they be notified, or do they have to find out on their own?
I'm hoping, and this is not up to me, I'm hoping that the state and the city will notify people what phase they're in and tell them when they can get the vaccine and how to sign up. This is actually the reason we're having this conversation, because we're going to try to apply this to our website, where we'll update it every week and basically be able to help people go through that. Because I love the CDC and I love the NIH, but a lot of their stuff is confusing.
And Doc, you saying there's no side effects regardless of what else you may be taking with this drug?
No, we do not know of any.
No matter what medication you're taking already?
Yep, no matter what medicine you're taking, there is no side effect. I mean, you have to think, and then, I don't want to get too cavalier, but compared to, which medicine goes with coronavirus. There is no medicine that goes with coronavirus, just, the risk of dying.
Uh-huh.
So, okay.
I have one other question.
Yes.
What would you say would be a percentage of people taking it that would make the most difference?
Oh, and I because I'm a news freak and listen to this. So Dr. Fauci, who I love, is a very, very smart gentleman. He says 90%. However, that's not exactly true. It would be 90% of people with immunity. Now, we've got people who've had the virus, so theoretically they're immune. So, with Oklahoma having 2,000 or 3,000 people per day, and we're getting millions of people infected, there will be some unfortunate people who are immune. And then, so with that said, if you can get 70% of people vaccinated, we will be much safer, so we wouldn't be wearing a mask. So, if you say everybody's not going to everybody's going to get vaccinated, it would be 90%. But the rate we're going, it would be closer to 70% of the people getting vaccinated would make us safe.
Great, thank you.
And that's the latest information that I've got. That may change next week.
Mm-hmm.
So,
I have a question.
yes.
If you go to get the vaccine and you have the coronavirus, you don't know that you have it, but maybe you're asymptomatic, or maybe it hasn't started to take effect yet. Can you still get the vaccine, or do they test you before you get the vaccine?
That's a great question. The answer is they don't test you before, but they're every place is like my office. Have you had in contact with anybody in the last 72 hours? Have you had symptoms? They will ask you those questions, but no, nobody's going to test you before you get the vaccination. And so as long as you're, answering the same question you would answer to see me, then you should be able to get the vaccination. The other question is, should you get the vaccination after you've had how long after you've had the virus? And that is out to debate. Some people are saying 2 weeks after you've had the virus, you can get the vaccine. Some people are saying 3 months. That's something that I would, in that case, if you already had the virus and confirmed, I wouldn't rush to get a vaccine, mainly because the other people who haven't got it yet can get it. And then I would actually refer to the CDC guidelines to see when you should get the vaccination.
Okay.
Does that answer your
Thank you.
question? I'm sorry, I went off.
Yes,
Okay.
that answers my question. And
Okay.
one other question, do you offer the test, the quick test?
So we have a limited supply of the quick test. We are reserving it for people that either are exposed or have symptoms. We are doing some testing on for people to return to work. Though just recently, the quick test we've got, they're saying if you've not had exposure and no symptoms, that test is not as accurate. So we're and that just happened this weekend. So we may be restricting who we're doing that testing to, just people who are exposed and asymptomatic, and maybe not testing people to return to work.
Okay, well, I'm that government worker. And somebody close to me, I mean, they have COVID now. There's been 2 deaths. And you scared me when you said if you have sinuses in the wintertime. You
Well,
know,
well, if you know, and this is more individual than we normally do, but if you've been exposed and you've got any symptoms at all, you should get a test, and I would get a rapid test. And we do provide those here. So I would call. Right now, you can call our office. Right now, you can call our office, and we schedule for you to get a test, for individuals to get a test that are exposed and/or have symptoms.
okay, thank you.
Yes.
That's a charge today, isn't it, Doc? For the rapid test?
Yes. And I don't know how much, as a doctor, I don't really pay attention to how much stuff costs. So we usually bill the insurance company. And I don't know the details of how much that costs. I know we only have enough to do our patients. There is a place called First Med that will do anybody, but I actually don't know how much it costs.
Dr. Lund, another question came in. Does blood type matter?
No. There's a myth going around that blood type protects you or does something. It does not. In fact, I don't even know my blood type, because now it used to be that we would do blood transfusions people to people. Now we don't. We test everybody's blood for all the markers of blood type. So there's been a whole bunch of talk about blood types protect you or something like that. There's, blood types don't help. It'd make my life easier if I could just label a person A positive and say they're safe, but it doesn't happen.
Dr. Lund, another question came in. Do you know if there's been any research that has proven whether you can or cannot get if you've already had the virus, if you can get the virus more than once?
Yes, you can get it more than once. There's been documented cases out of China, the UK, and the United States where people have gotten the virus, gotten over it, and months later caught it again. It's not common, but it has happened.
Dr. Lund,
Yes.
can you speak to what's in the vaccine?
Yeah. So this is one of the greatest things, and this has to do with the healthcare system worldwide. So this vaccine is a messenger RNA. When we talk, let me tell you how this vaccine was developed and why it was developed so fast.
Okay.
We've had 3 epidemics in the last 10 years: Ebola, SARS, and MERS. We actually have vaccines for all of those, but we've not rolled those out. This technology has been developed 10 years ago where you get a messenger RNA. So what they did was January 2020, they released the DNA sequence of the virus. Everybody started working on a vaccine. RNA messenger they're little snippets that tell the virus how to replicate. So it's not even the virus. So they use the messenger RNA has the mode to get it, which is one. We did that with SARS and MERS, and we developed vaccines. The reason we don't have vaccines against those diseases is that we squashed them by doing control. Like, we only had like 3 cases of Ebola in the United States, but we squashed it in Africa. So, and then it has some other substrates to make it work a little better, which is actually, they think that the substrates that make the vaccine work a little better is what people may have the mild allergy to. But it is not a watered down version of the vaccine. You cannot get corona from this. You can have corona and get it 2 weeks later because the vaccine, it usually takes 2 weeks for it to be effective. In this vaccine, you're getting the first one, and like I got, so I'm still not protected till next week. And then the week after I get my second dose, and I'll be 95% protected. So is that a long answer to a simple question? What's in it? I can tell you what's not in it. There is no thing that's going to track you in it.
Speak to that too. People are,
yeah.
about what's not in it.
Yeah. There's no tracking device. So, okay.
Thank you.
Yes.
Well, speaking along that, Dr. Lund, another question came in, just talking about that process. A little bit about the process when things go through the FDA. What are the controls that are in place to ensure that a vaccination or a vaccine like this is safe?
So the controls are basically the clinical trials and the safety thing. So when you get a vaccine, the first thing they do, they try it on animals to make sure it's safe and it's somewhat effective. Then you do what's called phase one, where you do it on a test group of humans to see how much you need. So you would basically get maybe 500 volunteers, and that's how they came up with the 2-dose regimen. Then you go to phase 3 and roll out where you get 30,000 people in the pool where you have 15,000 getting the vaccine and 15,000 getting a placebo. Then you just wait for 100 people to catch the virus and you see which ones got sick. In this case, and in the US has higher standards than the rest of the world. That's the reason we only have 2 vaccines, because most of the world will go with 10,000 people. The US does 30,000. So we have 2 other vaccine trials, and these vaccines trials are running now to get the 30,000. They've already been approved in India and in the UK, but we have a higher standard in the United States. And I actually do some principal investigating. So when you do this, you have to list everything that happens to a patient while they're on this drug. The patient fell down and hit their head. You have to list that as, potential side effect. So it's very, 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 they're very clear when they do these things to make sure safety is the first protocol.
All right, got a question. Barbara, I see you. I just think I took you off mute. Do you have a question for Dr. Lund? No, I think I lost Barbara.
Mm-hmm.
Barbara, are you there?
This is Tanya, and you just asked. I just saw a message that said for me to unmute.
Okay.
I did, but I'm gonna mute myself back because I'm not Barbara.
Okay, sorry about that. Do you have a question, Tanya, or did you already get your question answered? You do.
Yes,
I got a couple of them answered. The other question was, there was a incident that I heard about that a nurse who received the vaccine got Bell's palsy. And I was wondering,
that's most likely a coincidence. Bell's palsy. You got to remember, people still get sick. When you're doing 1 million people a day, people are still going to get sick. Bell's palsy is a viral illness. I, as a practicing physician, could not actually figure out how somebody would get Bell's palsy because of the vaccine. Because the vaccine is not a virus. So Bell's palsy, you will have coincidences. You may have an accident driving back from the thing that's not caused from the vaccine. The you know the sky might change and become night. That's not from the vaccine. That's a coincidence. We can't. Well, we shouldn't, and I say can't. We should not conflate everything that happens because of the vaccine. It's simple to say this is a cause and effect. It's like the flu vaccine. Every year I give the flu vaccine. People say, Doc, I got the flu from the vaccine. Well, most people didn't get the flu. They got a cold. Well, why'd you get a cold? Because we gave the flu vaccine in November. What happens in November? We get colds. The flu vaccine had nothing to do with it. But people say, Doc, every year when I take that flu vaccine, I get the flu. No, every year you catch a cold, just like I do. I catch a cold because I'm seeing patients who think they got the flu and they got a cold. So I'll get off that rant. I'm sorry.
That's what I was saying earlier, Doc, about our mental battles we have to fight. Those kind of things we have to look at, that we have to realize just because A happened, don't mean it
How long
happened because
does
of
this
this.
vaccine last?
Oh, that's a great question. We don't know. The good thing right now is that you can't say everything. The vaccine, the disease is 1 year old. The vaccine is basically months old. Right now, they know it works for the first 3 to 6 months. They're still running the current clinical trials to see on those initial patients to see how long it works. So it may be a vaccine that works 2 to 3 years, maybe a vaccine that lasts 1 year like flu, maybe a vaccine that lasts 40 years like tetanus. Like, people always say, I have to get a booster. Well, the reason children get vaccination, they have to get booster shots. That is the term, booster. If you get cut and you had your tetanus 50 years ago, I'm going to give you a booster. So the answer is we don't know. And it probably took us 50 years to figure out how many boosters you needed for tetanus. So,
Dr. Lund,
yes.
I read that the 95% effectiveness is one rate, but if you're an elderly person like moi, it's 86% effective.
Yeah, that's still better than mumps and measles.
I know, but that's true. It's different.
It may be true, but see, when we say effectiveness, there's two things. We're looking at whether you can catch the disease, but the other thing that people have to look out for is how sick will you get? Because currently, after the people get the vaccination, even if they catch the disease, their illness is minor. So so yes, 86%, it may be slightly lower, but you most likely won't end up in the hospital. And this is something that's really, this disease has some effect on the cardiovascular system. So even young people who get it may have some cardiovascular effects long-term for their heart. So the vaccine may, and I don't know, may protect you against those long-term side effects, even if you catch the disease again.
Thank you.
Yes.
We've got a few more minutes with Dr. Charles. If you have a question, feel free to come off mute and ask. One other question in the chat, Dr. Lund, was, should a person or persons that may be on dialysis take the vaccination?
Yes, I'm going to go back to my thing. There is no contraindication. Everybody should get the vaccine. I would say if you're on dialysis, you're at higher risk of getting really, really sick from the virus. But yes, there is no contraindication for anybody, and dialysis would probably you would be in my top of my phase 3 and possibly phase 2 group. Because if a person's on dialysis, they have to get in with a group every week. That's the reason, when we see this virus, you see where it's going. Almost 40% of all the deaths have occurred in nursing homes worldwide. If you have to be in with a group, that's probably the most dangerous setting. So yes, I would take that vaccine, and we should be able to, and that would be one of the places I would imagine the dialysis unit wants to get people vaccinated. One of the things people don't understand is that when you look at nursing home and assisted livings, when it gets in there, yes, it kills the residents, but you will also see about 10% of the healthcare workers also die. So you're going to see institutions that are going to really want their employees to be vaccinated along with the people at high risk.
All right, thank you.
Yeah.
Or Rita, do you have any final questions before we wrap up?
I was just going to say, Doctor, I'm not giving this to people that already have the disease, are they?
They don't. They are not screening anybody. So if you'd already had the disease and you're asymptomatic,
I mean, it's in the hospital.
Oh no, they are not. You know, not if somebody's in the hospital, they're not giving it to them. I don't. Yeah, that doesn't make any sense.
Yeah.
So yeah.
That's it. Thank you so much.
Yeah. Any other
Thank you.
questions?
I just want to commend you for doing this today, and Greg, both of you, and William, and people, just get your questions answered and get your fears dispelled and take the vaccination. Thank you.
Yes. You know, this
Dr.
was
Delon.
great.
Thank
I
you, Greg.
really do appreciate everybody asking the questions, and we should do this again soon.
We should.
We should.
So again, as I mentioned in the beginning of the call, to know that our website is centennialhealth.com. That's a resource for you to go to. Most of you, obviously, as patients of Centennial Health, have our phone number. We have recorded this message as well. So we'll have a link available. So if there are neighbors and friends that you know that think could benefit by getting some of these questions answered from your healthcare provider, Dr. Lund, there's a way you can, we can provide a way that you can actually share this particular link. And then we do hope to continue the call as well. So having a continual update. So continue to watch our website. If you're on social media, Facebook, YouTube, Centennial Health has its own channel to check that periodically. And we promise to put some update information out there as well. Dr. Lund has said this to me several times. One of the things we have to remember is information, data is changing very quickly. And so we had this call today. 3 days from now, there may be new information that we update you on. And so what we promise to do is try to keep you updated as quick as possible with the information provided. Again, thank you, Dr. Lund, Rita, and William.
Thank you. Thank you, everybody. Thank
All right.
you. Bye-bye.
Everybody.
Okay.
Have a good day. Bye.